Dr. Joe Greer. We're so honored to have Dr. Greer. So I'll call him up. He is the founding dean of Roseman University in Las Vegas. And I mean, he's exceptional. If you look through his bio, I'm not really sure how much I can say other than across the country, he's made exceptional advances, and he's part of health policy and schools of medicine and in Florida. And he's also a hepatologist, so trained in internal medicine and hepatology. And so we're so honored. I know I love talking to you, Dr. Greer, because I love that you love to push the envelope and you're very honest. And so we would love to have your expertise here to close out our event. Thank you.
I'm going to talk about medicine, medical education, and it needs to change things to get to true health equity. We do not have health equity in this country. We do not have a healthy country. We do not have good outcomes. We suck. We're twice as expensive as the next country, which is Switzerland. And you have 45 other nations that are ahead of us in health outcomes. We rank last in almost every single figure when it comes to industrialized and first world countries. Maternal mortality. We're like 19th in the world. And if you're Black, it's 9 times higher. And if you're Native American, it's 20 times higher. So that puts us at about 100 and something depending. You have a longer survival if you live in Bangladesh than if you live in Mississippi. You have a longer survival in lieu of all the gang wars that are going on in Haiti to live in Haiti than if you're a Native American. And you get sometimes the same resources. No water, no electricity, no internet. I'm a hepatologist. I did medicine, GI, and hepatology because Cubans had twice the incidence of liver cancer as the rest of Americans until we discovered the antibody to hepatitis C in 1989, done by some researchers at Chiron Lab out in San Francisco. And we found out it was hepatitis C. We retested the bloods. But this was only for upper middle class, wealthy Cubans because they were fanatics about healthcare. So they had their own syringe and needle in their own house. And they boil it for 10 minutes, which killed all viruses except for hepatitis C. So all you needed was one person in the family with a non-A, non-B, most probably from a blood transfusion or sexually transmitted. God forbid that islands have that problem. And it's a virus that's not really going to manifest itself clinically for 20 to 40 years, unless you're HIV positive. And then for a while there in the early 1990s, it was the #1 killer of HIV patients on the East Coast of the United States of America. So, why do I fight this battle? Well, because that's the way I was brought up. An old joke of an American that goes to visit Cuba. The Cuban says, "Let me show you our most popular sport." So he takes him to a cockfight. The American goes, "That's your most popular sport?" Cuban says, "Yeah." He goes, "My God, isn't it revolting?" He said, "No, that's our second favorite sport." So I'm about a little bit about pushing the envelope and about a revolution. It's interesting, my daughter, I married way up, by the way. I've been married for 43 years. My wife tells me it's the best 2 years of her life. But my daughter got into every law school from Yale on down. I told her she couldn't go to Yale because my mother would pronounce it jail. And she had scholarships everywhere, but she chose one that didn't give her a scholarship. So she ended up at Harvard. And she does movement lawyering and public interest law. But I asked her, I said, "I know you're smart. I married up. I know you like to help people. Why don't you want to be a doctor?" And she just looked at me and said, "Dad, you guys don't get it. Physicians are doctors to people. Lawyers should be doctors for society." Well, I think we need to stand up as a future physician class and physicians and be the leaders in the society that give people opportunities, that give people health to speak out. You guys, when it comes to an election, and I've been through a lot of them, it's really not about your pocketbook, especially in the medical class. We do well. We do a lot better than the rest of this country. I look at it that way. My father was the first gen. He's the first one in our family to finish high school, much less go to college or medical school. And he got to fly up to Cambridge to go see his granddaughter graduate from an Ivy League school. From Los Arroyos de Mantua, Pinal del Rio, Cuba. Guajiro de Cuba. Ends up in Cambridge to see his granddaughter. To graduate with a degree that could have made her as wealthy as possible. And she decided not to go for that. So that way I can keep working and supporting her. All forms of inequity, inequality, injustice in health, and injustice in healthcare is the most shocking and inhumane. Our lives begin to end the day we become silent about things that matter. Yes, we are the advocates for our patients and their families, but we see things that extend beyond that. You can no longer teach diabetes in medical school. You have to teach it in the context of the social environment of the individual. A homeless diabetic is going to be treated very differently than the CEO with a private chef. So the same disease, and in the case of the homeless individual, a disease with non-biologic origins, that's called the social determinants of medicine. You can call it whatever else you want. 80 to 90% of all diseases in this country have a non-biologic cause. These are social and public policies, education, funding for programs, transportation. The fact that the state of Florida does not require Section 8 housing to have a fan or an air conditioner. Really? When it's 95 in Vegas, it says, feels like 88. When it's 95 in South Florida, it says feels like 120 because of the humidity. What do you think that does to a diabetic? What do you think that does to somebody with cardiovascular disease? Are we going to give them more pills? Or do we do like we like to do? Take the bus, come to our clinic. Of course, you're going to walk 4 blocks in the heat. And when you show up, your blood pressure's up. Forget the white coat syndrome. Just from the heat and the volume depletion. So what do we as good physicians do? We increase the medication. Without looking at the conditions that are going on within this patient. This is how we have to educate our future workforce in health and health provision. Why? Because if not, people aren't going to have opportunities. If we're not prepared in that way, we can miss a diagnosis. When I was an intern, your parents probably weren't born when I was an intern, I had a patient that came in with DKA, diabetic ketoacidosis. Volume repletion, insulin, control that blood sugar, discharge her home with the same units of insulin that she was using. She ended up coming back in a hypoglycemic coma with neurologic defects. She didn't have a home to go to. She had a couch to sleep on. She didn't have the same food that we were feeding her, so we kept giving her insulin. And we emphasize the importance of that so much that she never stopped. Am I medically liable? No. Am I morally liable? Hell yeah. You think I'm ever going to forget about her? My whole career, my whole life? No matter how busy I was, and we were on 36 off 12 in those days, all I had to ask was, where do you go after discharge? All I had to ask was, do you have enough to eat? Questions that should have been there, that I should have asked, and I didn't, and a human life suffers because of that. So it's just not knowing the science. Because medicine, clinical medicine is not just about science, it's equally about art. Things that we're saying about with patients. I was at the university, I left for 20 years, I came back to the academics. And one of the things we used to do in our private practice, now we're super subspecialists, we were surgeons, hepatologists, gastroenterologists. I made every doctor go in the waiting room and get their own patient. You guys, I have never been to a business meeting where they stick me in a gown that's like an HMO because it doesn't cover everything. Put me in a room by myself with either video or posters of disease, with a tray with instruments, a glove and KY jelly, that's really appealing, and comes in for 10 minutes. That's not how you treat people. Might be more efficient for us. I also never introduced myself as Dr. Greer in the waiting room or to anybody. Why? Why do I want to start a power differential, especially when I need a history from you? It's a simple courtesy. So what is health equity? Everybody has a fair and just opportunity to be as healthy as possible. The definition continues. This is from RWJ, Robert Johnson's foundation. Removing obstacles to health, such as poverty, discrimination, their consequences, including powerlessness and a lack of access to good jobs, with fair pay, quality education, housing, a safe environment, and healthcare. Is education important? Well, in South Florida, where I came from, Miami, we had started a med school there at Florida International University. Nobody's heard of it because the football team sucks, but it still has 66,000 students. And down there, our home is in a place called Coral Gables. I refer to Coral Gables as a city for the financially gifted. 8th Street, or like Iocho, which is to our north, is the border of Coral Gables to the north. The city of Miami sits to the north of that. There's a 16-year difference in survival on the north side of 8th Street and the south side of 8th Street. Why is that? Because in Coral Gables, almost 90% of the populace there has a college degree or higher. Across the street, it's like 20%. Does education matter? Well, for about 16 years of your life, perhaps. Health, not healthcare. It's something very different. Very, very different. And policy is also equally as different. There's healthcare policy and health economics, which I think is like voodoo. And then there's health policies, transportation, green space, education, the ability to eat. What a concept in a country like America, the ability to eat, the ability to have access to the internet. Yes, telemedicine was great during the pandemic. We had developed it originally decades ago for rural areas. Except when the pandemic hit, if you didn't have a doctor, telemedicine didn't matter. And in communities of color, our communities, they had no doctor. They're hourly workers. They have no benefits. When an hourly worker comes to see us, guess what? They made a conscious decision to make 20% less that week in their income because they have to go see a doctor. That doesn't include the cost or the copay or the sliding scale. It doesn't include what we prescribe. So we get mad at them and say, why haven't you had your mammogram or your colonoscopy? Well, I got kicked out of the house, been foreclosed. Oh, by the way, your blood works perfect. EKG's good, chest x-ray, physical exam's nice. I know you're losing your house to foreclosure. Your spouse is leaving you and you have an opioid use disorder child. But be happy because your labs are wrong. Let's put life in the perspective of the human being that we're taking care of. So what are the policies that affect health? I could have gone on and on and on and on, all of those. They all affect health. So when somebody says, why are we talking about gun violence? It's not in our lane. Well, if they show up in our emergency room, it sure as hell is in our lane. And if they show up because of poverty, yeah, that's in our lane. If they show up because of lack of education, yeah, that's in our lane. And we're going to export 10 million immigrants? Who's going to do that work? And it's just not the fields. If you go to South Florida or New York, it's taking care of patients with dementia. Why is that? Because the United States spends more money on dementia than it does on cardiovascular and oncology put together. The average cost of a patient with dementia is $90,000 a year. When the average income in America for a family of four is $67,000 a year, little Johnny gets pulled out of school to take care of the aunt because everybody else is working. So not only does an individual suffer with a disease, a child no longer has a future that's economically viable. Where do we fit in? We got to change these policies. We have to work on this and be rigorous with appropriate policy analysis and do it. The most important thing I want to let you know is not the state or federal level. It's your local level. It's your transportation, it's your education, It's all the different things you can do locally. This is not a big movement. I wish it was. It's a local movement. All politics are local. Hard rock concept. Where do we start to end health disparities? Let's start with medical education, pre-med requirements, racism, sexism, xenophobia, elitism. Let's bring back real virtues to medicine. 8% of American medical students are Black, 3% are males, 3.8% of faculty are African Americans. Are we racist? Well, I don't know. Look at the numbers. You guys, it doesn't take Fellini to figure this out. Oh, but they're not prepared. They're not prepared for medical school. Same thing with all Hispanic kids. We can't take them. Really? Is that the way it works? Well, that's bullshit. And I'm going to tell you why. At FIU, Florida International University, we opened that university in 2009. 72% of our students only got into our school. 72%. 38% were first gens. Every graduating class we had till we came out to Vegas in 2020 had the highest pass rates for step one and the highest scores in the entire southeastern United States. We were the second most diverse medical school in America. 58% of our students were of color. Number one in match in the state of Florida. Why? Because we gave people their support services. We gave people that had never been to college before and their family the support they needed, even if you needed an extra year. The same thing we're doing in Vegas. If you need to repeat a year and we're helping you out, I'm not going to charge you for the next year. Charge you enough for the first year. Charge way too much in med school. We charge way too much. Are we sexist? Well, 53% of American medical students are women, which means about half of our working population in healthcare are women. Less than 19% are chairs. If 50% of the population that's working are women, why are less than 1/5 in leadership positions? And the Ray Corporation, of which I am a trustee at, which is the oldest and largest think tank in this country that does policy analysis and develops methodologies, we did a study and we found out that female doctors of the same specialty as a man make an average of $2 million less in their careers. Diversity is one thing. You would think equity and inclusion were included with it. And by the way, there's so many studies that show that my gender is not as good as the female gender as being a physician. And New England Journal of Medicine, about, I guess, almost 8 months, a year ago, had one that said you're better surgeons. Damn, we're losing everywhere. I have my wife, my daughter, my granddaughter. I have nowhere to go. I get ordered everywhere. Are we xenophobic? 6.7% of American medical students are Latin. 3.6% are chairs. I'm one of 4 Hispanic deans in this country. 2 are in Puerto Rico. You know, I'm old enough to have been the first keynote speaker at the National Hispanic Medical Association. Okay. My career was already going at that point. But I remember this is what I said. And I still feel very strongly. I am not a Hispanic physician. I am a physician who happens to be Hispanic. I think the experience I had growing up as a minority, all the things that happened to me, should be offered to all populations that need it. Because it's just not us. There's those that have been worse off than us for longer than us, the African Americans in this country. And the other recent immigrants with the anti-immigrant sense that's going on in this country. We need to stand up and defend them. Our motto at FIU was, we will see patients without prejudice. That means race, ethnicity, gender, lifestyle, ability to pay, without prejudice. How is it that when you apply to medical school, you write a letter saying you want to save the world? Then you do the white coat ceremony. Take another oath then. And the Waco ceremony, the oath from the Gold Foundation actually uses the word social justice. Then you train in a public hospital where the indigent, the poorest of the poor, come for help. That's where you learn to be a doctor. You learn how to do a lumbar puncture. You learn how to put in a central line. You learn how to put in a simple IV. You know what? Private hospitals, the CEO isn't going to let you do that. They're going to ask for the attending because we haven't done that in 50 years. But they'll ask us to do it anyway because we're the old ones. Then we take another oath when we graduate. Then we go into practice. And you have Medicaid? No, I'm not taking that. You have no money? No. I'm sorry, this is a business. I got to maintain my business. I have to buy a new car every year. And I can't miss my European vacation, God forbid. You guys are going into a career of service where you serve others. We serve people through humility, which is something lacking in our profession greatly too. Are we elitists? Well, the median income of matriculating class of 2020 was 140,000. 67,000 was the median income. So more than double the national median income. Medical students pay in private education, or if they're from out of the state, around 67,000 a year. They pay as much in matriculation as a family of four on the average makes in this country. Do you think they have really any understandings of the realities of that family? No. Especially that I just gave you the breakdown of American medical students and where they came from. They're like my kids. Private schools their whole life. You know, the values they learned at home, the values they learned at school, the values they learned with whatever faith you have is what made them who they are. Now, I have an older daughter and a younger son. Now, when that happens, the female gender is so much more advanced that I was sure we had dropped our son on his head at a very early age. They both went through private Catholic education for 16 years. My daughter did the Jesuit volunteer corps where she worked in San Francisco on $8,000 a year to learn humility. She went to Harvard and they got rid of it in like 7 seconds. My son, also a philosophy major and theology major at Loyola Marymount, is now a professional comedian and actor. You see the divergence? Like he goes, I come home, you talk about starting a medical school. A lot is talking about helping people and the poor and getting housing. And all I can talk about are fart jokes. And I said, that's pretty much it, yeah. Where did our virtues go? I want you to realize this is from Sir William Osler. He founded Johns Hopkins, by the way. This is 1906, 118 years ago. In these days of aggressive self-assertion, when the stress of competition is so keen and the desire to make the most of oneself so universal, it may seem a little old-fashioned to preach the necessity of humility. But I insist that a due humility should take the place of honor on your list of virtues. Medical education has got to come back to nurture the virtues you enter medical school with. Statistic after statistic, paper after paper, empathy drops to the floor after your third year of medical school. Oncology journals show where patients perceive their oncologist to be empathetic 20% of the time. That's once every 5 visits. You don't know how many conferences I've been to where I was on at UVA a few years back where how do we get the architects involved so we can have an empathetic environment for the patient because the doctor's not doing it? Well, this comes back to admissions. We're really good with the quantitative. What's your score? What's your GPA? What kind of person are you? So one of the things we've done, because I'm a big believer in first gens, we came out here understanding a few things. First of all, Reno has much better medicine than Las Vegas. Number one. Number two, the state of Nevada ranks 49th in PCPs and general surgeons to the general population per 100,000. Does anybody have any idea what the highest number of students from the state of Nevada that applied to medical school was? That was in 2021. You know how many students that was? 410. 410 students. That's why pathway programs are so important. We have a similar thing. We call it Aspire, APIA, and Rose Grows in the Desert, where we take first-gen kids in middle school and we do a whole day of STEAM. So they learn everything from coding to AI to mindfulness to gardening to the arts to music. And we do this with our faculty, the students, and their parents, so we can talk to the parents and tell them the opportunities are there. And then we talk about Roseman. And guess what? We're doing a program now we're going to do with Nevada State, where I'm going to take first generation, third year students, students after their third year, who have at least a 3.0 average. I'm going to put them in a highly rigorous and intensive, which we've already started, master's program in biomedical sciences. That'll actually give me a 2-year interview period, but it prepares them for the rigors of medical school. And when I think about these things, you guys, you don't have to be smart to go to medical school. You have to be disciplined. You have to be dedicated. You gotta be a little smart. But you know, I remember the worst thing, when you start off in med school, what do they say? You're the smartest, the brightest and the smartest. And I used to think, wow, if only Einstein had gone to med school. Just think how well he could have done. So don't think so much of ourselves. C.S. Lewis once wrote on humility. Humility is not thinking less of yourself. Humility is thinking of yourself less. And I have that sign outside the dean's office. And I require all my senior faculty and those that we hire the importance of character being shown. Why? Because higher education is highly toxic. Just call it as it is. Medical education is toxic as hell. Hell, we have jokes like, you know why the walls of academic hospitals are so clean? Because doctors have to walk with their backs to them. You know, that's better than me. And so fight against that. Remember why you're here. I was told one time, write down why you want to go to med school before you start. Fold it up, put it in a drawer. When you get frustrated, when you get tired, when you think it's overwhelming, open that drawer and read that note. And it reminds you of why you wanted to go to medical school. Same token, the same individual told me, always carry a little notebook and take notes of things you have to study that night or of experiences you've had, your interactions with patients. The woman with the diabetic ketoacidosis. My first Christmas Eve on call, and a 22-year-old Puerto Rican single mother comes in with smoke inhalation along with her 4-year-old because her infant didn't make it. Because she went out to get milk and the Christmas tree caught fire. She went in to try and save her. I had to take care of smoke inhalation in 2 people. Christmas Eve, 22 years old. She loses a baby. Why? Because of poverty. Once again, preventable. Social and public policies are the cornerstone of health equity. Death of despair. I bring this forward because since 2015, the United States has seen an increase in morbidity and mortality. The first time since 1916 during World War I and what they call the Spanish flu, which actually started in Nebraska. It was actually a regiment from Nebraska that took the disease with them over to Spain. But anyways, history is history. Death of despair. In 2015, we went up, everybody else in the world went down. This was because of suicide, opioid overdoses, and alcoholic liver disease. This is how the world looked. France, Germany, UK, Canada, Sweden. US white non-Hispanic males. Look where they sit on the very top right. Not Hispanics, not blacks. What was the differentiating factor in that population? Those with a bachelor's degree or more, this is the line they had, which was almost a straight line with those 3 causes of death. Look at what happens when you don't have an education. You don't have a job. Can't take care of yourself. As a cultural anthropologist, a good friend of mine, Gary Ryan, told me, rural America is becoming the new inner city with drugs, with the federal help and all that. So it's all that. Why weren't the Hispanics and blacks there? Want to know why? Go back to the beginning here when I talked about racism and xenophobia. If you're Black or you're Hispanic and you show up in the ED with pain, more often than not, they're going to think you're a drug seeker. If you're white, they think you got pain. So although we want to blame the whole fentanyl thing on Big Pharma, you guys, it was MDs and DOs that wrote the prescriptions. You know, we wrote the prescription. Just call it as it is. It's our fault. And if we don't address mental health in this country, which is the #1 public health problem, we're going to continue with this. Down at our school, we have 3 programs, the Aspire one I told you about. One which is called Empowered, which we work up here too and up in Carson City, which is for opioid use disorder, pregnant women, and recent mothers. I'm a big believer that we have to have social accountability. And the students are only going to learn that if we're actually doing it. And the third one is we developed a whole new system of delivery of care for uninsured and Medicaid, and we call it household-centered care, where we have a multidisciplinary team that goes to the household and takes care of them from social, legal, everything to medical. Our medical students will be assigned 2 households that they are responsible for 4 years, just like we did in South Florida. There, they only had 1 household. There, they not only get to learn the longitudinal care of a family, the evolution of the family. Your 4th year. After your internship and residency, guess what? Life's not broken up into 12 weeks. It's sort of continuous. And you have to learn that from the beginning. So what do we do as individual physicians, as educators, as an industry? Get involved in real policy advocacy and after appropriate analysis of that policy. Analysis is so important. And in this case, it's mostly quantitative, but some qualitative aspects to it. Learn qualitative analysis as well as quantitative, because that's what we're missing out with in medicine. Don't forget local policy. Change the curriculums. That's what we're doing. We changed the curriculum to adapt to this future world. I changed the curriculum so that I can also begin. I brought in actually the former dean at UNLV School of Hospitality, wrote a book called Hospitable Healthcare, very academic. He's from Cornell originally. To integrate it into our curriculum. Why is that? We need to learn how to do patient satisfaction. You know why? Because if not, you guys aren't going to get paid in the future. 1/3 of your income is going to come from that. But it's also a really good business sense. Treat the patient as the most important. In every single business in the world, the customer comes first, except in healthcare. And we like to make the doctor come first. Well, it's not about the doctor. It's about those that we're taking care of. And it becomes important that we remember that. Let go of that ego a little bit. It's a little heavy anyways. In other words, I am not at our prior medical school in this one. If you're a great bench researcher and your dream is to go to Hopkins or to Harvard and do bench research, I don't want you. I want a clinician. This country needs clinicians. Medical schools can no longer be everything for everybody. We have to be regional. We have to see what is it that we need to develop. The other problem I had as an educator is, how do I produce the best physician? One thing I know is my job is to produce you to do residency. That's why I only have 3 departments. I don't have departments like medicine, family medicine, and all that. At our prior institution, I got rid of all primary care, and I put it under a department I started called Humanities, Health, and Society. Why is that? I'm tired of we're the primary care docs. No, we're the primary care docs. No, we're the primary care docs. You guys were all docs. Let me prepare you properly, and let's all work together. I'm going to read 2 stories. About 25 years ago, way before you guys were born, I published a book, which is now out of print after my parents and my family bought the 7 copies. And these were from stories that I remembered that I wrote. These came when I was an attending, though. This is at our homeless clinic that we had started. It was a Tuesday night at the clinic when a young woman in a tattered red dress came in. And she was about 25 years old, but she seemed a lot older. The lines of her battle-weary face barely concealed beneath a smudge of stale makeup. Her soiled clothes, a swath of spandex, told the story of her hard life on the streets. Her eyes revealed her turmoil. Whatever her story, at the very least, she deserved a bath and a rest. That night I was working with third and fourth year medical students, and I sent Carlos, a third year student, in exam room 2 where she sat weeping. Within minutes, the student rushed out of the exam room. Dr. Greer, Carlos called out to me in a hurried tone. I can't get a history out of her. I don't know what to do. I said, what's the problem, Carlos? I don't know. She's crying like a baby. I can't get her to talk to me. I said, what's your guess? Physical, emotional, drugs? I insisted getting on the signal, follow me. He says, I don't know. So the charts says she's been here once before, some derm problems. No history of psychological disorders noted. Well, she does smoke crack. And then smirkily he goes, must be the perks of prostitution. As an educator, talk about a moment to educate somebody. Who the hell are you to set a judgment on the oldest profession in the world because this poor person cannot make a living any other way? You're here to judge her on her disease and to improve her outcomes, not who she is or what she does. I stepped into the exam room with the nurse and found a desperate woman. She was trembling. I extended my hand to greet her. We're here to help you. Do you hurt somewhere? I asked, gently nudging her elbow to give her sense of stability. She was full of tears, gasping for air. It hurts down here, she said between sobs, holding her lower abdomen and doubling over. It feels like it's burning. It won't stop. Please help me, please. The nurse and I let her calm down a bit before I examined her completely. I palpated her tender belly and examined her further. I concluded that her symptoms in the exam suggested a mix of pelvic inflammatory disease and other sexually transmitted disorders. It'll be okay, I told her, trying to offer a little reassurance. Slowly, she began to tell us why she had really come to the clinic when she could have gone to the gynecologist at the public health clinic. I was raped. Raped hard last night, she said, as she doubled over in tears and in shame. Why didn't you go to the rape treatment center in Jackson? I asked. It was only about a mile away. Doctor, she said with a look that suggested I should know the answer to my own question. Look at me, she said. Look at how I'm dressed. She paused and then again broke into tears. I couldn't take the comments that people would make. You want to judge people? Somebody gets raped and the way we look at people and judge them, they don't get care. Really, are we that powerful? Is that what we're supposed to be, or are we supposed to be the example of compassion, of empathy, of extending the hand to help them? She was right. The mammoth health system of healthcare could offer excellent medical care and all of the best technology. But you know what, folks? Edifices and systems can offer no solace, no empathy, no protection from prejudice. That's because there's a gaping error in the construction. The heart was left out. That's you guys. You're the heart. You're going to be leaders, and you already are because you're in college or medical school or applying to medical school. That means you're a leader. And as a leader, you have to show that on a daily basis, not just to your patients, but to your coworkers, or perhaps those that work underneath you. Remember, we're the ones that keep that spirit going. A building's a building, an endoscope's an endoscope, a laser's a laser. We are who we are. And I'm going to finish up with this last story. This one also stuck with me. One afternoon around lunchtime, I walked into the clinic. This is a homeless clinic with a sandwich. I greeted the patients in the waiting room and walked over to the pediatric area where I found a mother with 3 of her kids. They had come in from the Salvation Army shelter. Youngest child caught my eyes. He was 6 years old, a little boy with a sweet smile. I'm Catholic. I have a sandwich in a homeless shelter. I feel guilty. Plus, I'm a non-purging bulimic, so I didn't really need the sandwich. I offered the youngest my bag lunch, which he graciously accepted. He took the sandwich out of the bag and split it in half. He took 2 bites out of one half and slid both parts into the bag. Then he carefully folded the bag and put it back in his pocket. Why'd you do that? I asked him. By this time, I had already finished finishing my fellowship. So I had done, college, med school, 7 years postdoc, had all these professors. Couldn't figure out why this kid was doing this. You ever think of what it's like to be a homeless kid? Statistically, it's a single parent. And you're in a shelter. You have an 8x10 room. I have 2 kids. Put me in on Friday with 2 kids In an 8x10 room, there's a good chance only I'm walking out on Monday. Okay? You don't have family dinners. You have shelter dinners. You have nothing that you own. And one year we asked in Christmas to the kids, what do you want for Christmas? You know what they told us? Socks and underwear. We get all these toys, and nobody gives us socks and underwear. Socrates once said, question assumptions. What we grew up with and what we have on a daily basis, somebody might not. So don't assume everybody has what we have. And particularly when you're going into therapeutic interventions in a patient and you're trying to help that family. Why'd you do that? I asked him. His reply stunned me. He looked up at me with a smile and he just said, oh, it's for my brothers. He was hungry, but he knew his brothers were just as hungry. In Coral Gables, if somebody offers you a sandwich, they call out the housekeeper to taste it to make sure she doesn't die or eat. Okay? Here, a little 6-year-old kid, hungry, homeless, in the worst situation you can be in a capitalist country, because we really don't like the poor. You know, come on, they failed. And that little boy taught me lessons I will never forget. In my morning prayers every day, I pray to be like that 6-year-old child, that I can go through life without judging somebody except in medicine and not make any rash comments or looks, because nobody knows what happened yesterday or the day before or the year before. We're supposed to be the ones that take the high road, folks. We're supposed to be the ones that do that. Prior to the pandemic, in the teens, doctors had an 85% approval rating, nurses the same. After the pandemic, we dropped down to 30%. American public perceives us as a conflict of interest. Number one cause of bankruptcy in America is a medical bankruptcy. They think that we prefer money over taking care of them, and that's why we send out billers. Nurses just take care of them. Think about that. God has allowed me to study medicine to explore the depths of disease and its treatments. He has given me brilliant professors and inspiring mentors. He has opened the tombs of healing and placed in my hands the most precise instruments of modern technology. And on any random afternoon, he has extended the most remarkable postgraduate opportunities to me. He's allowed me to find him in the gentle lull of the city of Miami, under a bridge in an emergency room, in the waiting room of a neighborhood clinic, in the wisdom and the humanity of a homeless child. The goodness of that child has stayed with me over the years, and I have often asked myself, could the lesson of his generosity be multiplied by a community, a government, an entire nation? Could such a spirit mend a broken system? Can we actually walk down the street and look at a disheveled man or woman and not pass judgment? Can we do that? Think about that. It's our community, it's our country. The world is ours to make better. First, you got to get through med school. So you got to learn the science. You have to learn the clinical. That's a given, folks. But the world is not that way anymore. If we don't understand all these other factors, then we fail in our intervention to improve the life of somebody else. Set the bar as high as possible. That's what I told my kids. I never want you to reach that bar, because once you reach it, you get lazy. You can set little bars, get into med school, pass this exam, but set the big bar to have true equity in this country and then the world. So these are the quotes I started with. That's what I'm ending up with. And you guys, the world is yours to make better. Just do it. Thank you. It was great to be the after lunch speaker. Any questions? Anybody wants, I'll give you my card. It has my cell phone number on there. I'm old. I don't do texting very well, but I do answer the phone. Yes, ma'am.
I do have a question. What's the name of your book?
Waking Up in America.
Thank you.
What happened was my both grandparents came to the United States in the 1940s. My grandfather, my mother came from Cuba to visit him for his birthday I was born 3 months premature. So after the revolution, since my father family came from no money and he was the first one to finish high school, the US government would not give us a visa. Cubans got a lot of extra nice things, but you had to have sort of money. So my daughter refers to me as America's first anchor baby. So it's out of print, but you can get it for $1 on Amazon if they have a copy. Get the paperback; it's cheaper. Any other questions? You guys, you have a lovely career ahead of you, and you have incredible challenges. You're the ones that give me hope every day. You guys, my kids, and my granddaughter. Make this world better. Thank you.